Welcome back to Houston Life. You know, here at the show, we are always looking for ways to stay healthy, and we found an easy one: body scanning.
Medical professionals are finding more ways to use this type of technology to benefit their patients and also themselves. Houston Life's Mel Camp visited Advanced Body Scan to have a chat with retired doctor and combat trauma surgeon Dirk Rodriguez about why he chose body scanning to protect his own health.
Well, let's start with talking about you. Who is Dr.
Who is Dr. Dirk Rodriguez? Yeah. Thankfully, right now, I am a retired surgeon, but in my career, I was a former Air Force aviator, and I had the opportunity to fly F-111s and F-15s. And subsequently, I became a surgeon. I was a combat and trauma surgeon in the United States Air Force. After leaving the Air Force, I was able to become a vascular surgeon, which helps people with circulation problems and heart problems, as well as a cancer surgeon.
So you're a risk taker, but when it comes to your health, you wouldn't say you are much of a risk taker, would you?
No, because of my service in the military and as well as being a surgeon, I had to take care of my body. Long hours, a lot of stress in your body, and so not smoking, limiting alcohol intake, eating right, and definitely exercising was a part of 40 years of my career. The important thing about advanced body scanning is that it provides early detection. And early detection means that the condition can be taken care of and even cured, and you can live a long, healthy life.
Dr. Dirk, as I call him, is a remarkable man. He's had a remarkable life. I'm envious that he flew F-15E strike fighters in the Air Force, and he's also been a surgeon all of his career. And as he says, again, prevention, early detection saves lives.
It's pretty amazing where technology has us today and how we really can take charge of our health and know a lot more about, you know, our future and where we're headed than ever before. How important is it for you to get a regular screening at Advanced Body Scan?
Well, I believe the most important thing is, number one, talking with your doctor, thinking more about our health. What's going to happen to us over the next 20, 30, or 40 years? The average lifespan here in the United States for men and women has now exceeded 75. You have to start thinking, how is my life and health going to be over the next 25 years? And the most important thing is, these are silent killers. You may have it in your body and not know about it. And the neat thing about body scanning is they discovered that it could find calcium, which is responsible for hardening of the arteries in the heart, which then leads to blockages of the arteries and heart attacks.
How do you use advanced body scanning yourself?
Even though I try to take care of myself as much as possible, I am a heart condition patient. I've had a heart condition. And what advanced body scanning does for me, it says, okay, Dirk, you were a swashbuckler, you were a pilot, you were a surgeon, you've jumped off of cliffs, you've jumped out in parachutes. Let's take a look in there and see what else might be going on inside your body. And thankfully for me, I'm okay. But I have had a heart condition that needed to be taken care of despite taking care of myself.
So it's critical, and it's more difficult than you think to get this test. And the reason is, if you go to the doctor and you don't have a symptom, there's really nothing they can order. You know, if you can't get some type of test approved, that's why we do this very inexpensive price to get a baseline scan, and we want you to come in because if you find it early, we can treat it early.
Talk to your doctor about advanced body screening. It is definitely worthwhile.